Andrew. My name is Haley. I'm a nurse practitioner student. I'm going to be doing an exam on you today. Do you have any questions before we get started?
No.
All right, I'm going to go ahead and perform hand hygiene. I'm going to first start by looking at Andrew's general appearance. He doesn't appear to be in any distress. He doesn't appear to be in any respiratory distress. I don't see any retractions. He's not having any difficulty breathing, no pursed lip breathing. He doesn't appear to be in any pain. I'm going to start the exam by looking at the posterior chest. So I'm going to go ahead and have you turn around. All right, so first I'm going to start with inspection of the posterior chest. So looking at his chest, he doesn't appear to have an abnormal shape. I don't see any kyphosis. I don't see a barrel chest or any scoliosis. His breathing pattern seems to be symmetrical between both sides. Now I'm going to go ahead and assess for tactile fremitus. So what I will do is place the palm of my hands in different spots on your back, and at each spot I'm going to have you say the words 99. Go ahead.
99, 99, 99, 99.
Okay, so when I did that, I felt a moderate vibration, which is a normal result for tactile fremitus. Now I'm going to go ahead and assess chest expansion. Go ahead and inhale. Okay, he had symmetrical chest expansion when I did that exam. Now I'm going to go ahead and perform percussion on his posterior lung fields. And I'm going to do that in a ladder pattern. And the lung sounds were resonant when I did percussion, which is a normal result. Now I'm going to go ahead and follow the same pattern and listen to his lung fields. Go ahead and breathe in and out. Okay, and since I already have his back facing this way, I'm going to go ahead and test for CVA tenderness, even though that is part of the abdominal portion of the exam. But for conveniency, I'm going to go ahead and assess that. So what I'm going to do is place my hand where your kidney is, and then I'm going to pound a fist on my hand. Let me know if you feel any pain or tenderness.
No pain.
Okay.
No pain.
Okay, now I'm going to go ahead and have you turn around. Now I'm going to inspect the anterior chest. He doesn't appear to have any retractions. He's not in any respiratory distress. So I'm going to go ahead and listen to his lung fields. Go ahead and breathe in and out. Okay, his lung sounds are clear in all lobes bilaterally. Now I'm going to go ahead and move to the cardiovascular part of the exam. So first I'm going to inspect the precordium. Just from looking at it, I don't see any visible pulsations. And I'm going to go ahead and palpate the 5 main areas. So the aortic is on the right in between the second intercostal space. Then the pulmonic, which is on the left, second intercostal space. And then Erb's point. And then the ventricular region. And then the point of maximal impulse, which is in the fifth intercostal space, also called the apical. And I am able to feel the PMI in this spot. It's not displaced. I didn't notice any extra pulsations, vibrations, or thrills. Now I'm going to go ahead and listen to his heart sounds. I'm going to use the diaphragm and the bell of the stethoscope, and I'm going to also take in the same pattern that I just palpated in. I'm going to go ahead and listen with the bell. Okay. His rhythm was regular. I heard S1 and S2. I didn't hear any extra beats, and there was no murmurs when listening to his heart. Now I'm going to go ahead and assess the carotid artery and assess it for any bruits or thrills. So first I'm going to auscultate. Okay, I did not hear a bruit upon auscultation. Now I'm going to go ahead and palpate. I do not feel any thrills, and his pulse is 2+. Now for the next portion of the exam, I am going to go ahead and have him lay down so I can get a better examination on your abdomen. Go ahead and lay down for me. Okay, so first I'm going to start with inspection of his abdomen. So looking at his abdomen, it is flat. I don't see any visible like masses or anything like that. I don't see any scars from any type of surgery he might have had. I'm going to go ahead now and listen to all 4 quadrants. Okay, bowel sounds were active in all 4 quadrants. They were normal active. Now I'm going to go ahead and listen to the abdominal aorta, the renal arteries, the iliac arteries, and the femoral arteries. First time listening to the aortic artery. And now the renal. The iliac, and the femoral. Okay, I did not hear any bruits while listening to those arteries. Next, I'm going to do percussion in all 4 quadrants of the abdomen. right, upon percussion, it was all tympanitic, which is a normal result upon percussion of the abdomen. Now I'm going to go ahead and perform light palpation in all 4 quadrants. All right, upon light palpation, I didn't feel any masses. His abdomen was nice and soft. I didn't feel any of his organs. And I'm going to go ahead and perform deep palpation with both of my hands. Again, upon deep palpation, I didn't feel any abnormal masses or organs. His abdomen was nice and soft. Now I'm going to go ahead and palpate the liver in the right upper quadrant. So I am able to feel the liver, I am able to feel the edges, it is nice and smooth. He has no hepatomegaly. And now I'm going to palpate the spleen in the left upper quadrant. And I was unable to palpate his spleen, which is normal, and so it is not enlarged, there's no splenomegaly. Okay, now I'm going to go ahead and check his pulses. I'm going to start with the radial pulse. They are 2+ and equal on both sides. Now I'm going to go ahead and move to the brachial. They are 2+ and equal on both sides as well. I'm going to go ahead and move to his lower extremity and assess the posterior tibialis and the dorsalis pedis pulses. Okay, the posterior tibial pulses are +2. The dorsalis pedis are also +2 and equal. And I'm going to assess for some leg edema. He does not have any edema in his legs. Thank you, Andrew, for participating in this exam. Do you have any questions for me?
No.
Okay, thank you.